Hello, I will be presenting information on gestational diabetes mellitus. This presentation also includes a case study. In the United States, 4 to 7% of pregnant women are diagnosed with gestational diabetes mellitus due to having high blood sugar levels during pregnancy. GDM affects pregnant women because of the hormones from the placenta. When the body makes more insulin than it should, the blood sugar levels will increase, which will cause diabetes during pregnancy. Those that are considered high risk for gestational diabetes mellitus have family history of diabetes, are overweight, are African American, Hispanic, American Asians, and American Indians. Do not do enough physical activity, have had diabetes before, is pre-diabetic, has polycystic ovary syndrome, and are at the age of 25 or older. Some complications of the child are higher birth weight, preterm labor, obesity, type 2 diabetes later in life, stillbirth, and hypoglycemia. Some complications for the mother are high blood pressure, possibility of cesarean section birth, having diabetes in the future, and preeclampsia. To get diagnosed for GDM, typically, a pregnant woman will be tested between 24 to 28 weeks during the second trimester. They will be given a glucose challenge test and will have to drink liquid with glucose and will have their blood drawn. If the results for the blood glucose come back high, they will be given an oral tolerance test, which includes fasting for 8 hours, then getting your blood drawn, then drink a liquid with glucose and get blood drawn each hour for 2 to 3 hours. Depending on the results, if the levels are higher, patient will be diagnosed with GDM. Some treatment for GDM consists of changing your diet and eating healthy nutrients like fruits, vegetables, whole grains, and lean protein, as well as exercising to lower your blood sugar. Monitoring your blood sugar levels throughout the day after each meals. Some people will be given insulin injections if needed to reach blood sugar to normal levels. I will now be presenting the case study. This patient named Joanna is preparing for the birth of her first child. She is a registered nurse and a 31-year-old Hispanic female. She has family history of type 2 diabetes. Prior to her pregnancy, she was following a keto diet but has found out that she was pregnant and changed her diet. She also follows an intense workout routine. This is the patient values. It shows her fasting blood glucose levels, which are within the normal range, but after the 3-hour plasma glucose level, her levels got higher. Her diagnosis shows that after the 3-hour OGTT level, her levels were pretty high and she was diagnosed with GDM. She is instructed to perform regular fingerprint glucose checks and monitor her pre-GL levels. It is recommended that she continues to eat a healthy diet consisting of healthy nutrients and daily exercising. She should also be monitoring her blood sugar levels often after each meal. I will now be answering the questions from the case study. The information from this case showed a patient having normal weight gain but having a high level of PGL. The relationship between PGL and gestational weight gain depends on the diet of the patient, as if the patient is eating food that will make their blood sugar levels go up. The patient is considered a high-risk patient. She is Hispanic, she is 31 years old, and she has had family history of diabetes mellitus, as well as her diet changing, which might be why she was diagnosed with GDM. It can be inferred about the weight of Joanna's baby that the baby's weight will be higher than the normal weight range. Joanna's plasma oxytocin levels are within the normal range for those in 24 to 40 weeks, which is going to help during the labor. To conclude, the research done for gestational diabetes mellitus shows the proper treatment needed for those diagnosed with GDM.